Question 1. In the context of radiopharmaceutical design, Dr. Williams is tasked with creating a new agent for myocardial perfusion imaging. She needs to consider factors such as half-life, chemical stability, and biological distribution. Which of the following is the most crucial consideration in ensuring the clinical utility of this radiopharmaceutical? A. The chemical purity of the radiopharmaceutical. B. The effective half-life matching the imaging window of myocardial tissue. C. The particle size of the radiopharmaceutical. D. The radionuclidic purity of the radiopharmaceutical. Answer. Correct answer. B. The effective half-life matching the imaging window of myocardial tissue. Explanation. The effective half-life must be carefully chosen to allow for optimal imaging during the specific time window for myocardial perfusion. The imaging should be conducted when the radiopharmaceutical is still active enough to provide clear images without overradiating the patient. Chemical purity, particle size, and radionuclidic purity are essential. Secondary to half-life when timing of the scan is the key factor in clinical outcomes. Question 2. Given the circumstances Mr. Johnson is working in a radiopharmacy and preparing a PET radiopharmaceutical, he needs to assess the radiochemical purity of the compound. Which of the following is the most suitable method for this assessment? A. Thin layer chromatography (TLC). B. Gas chromatography mass spectrometry (GS). C. High performance liquid chromatography (HPLC). D. Gamma spectrometry. Answer. Correct answer. A. Thin layer chromatography (TLC). Explanation. Thin layer chromatography (TLC) is commonly used for radiochemical purity testing because it can separate the radiolabeled species from free radionuclides or other chemical forms. In the context of PET radiopharmaceuticals, this method is especially effective at assessing the purity of the radiopharmaceutical to ensure no contamination from free radionuclides or materials. HPLC is also used for quality control, but TLC remains a staple for radiochemical purity testing due to its simplicity and effectiveness. Question 3. Under the assumption that you are assessing a radiopharmaceutical for quality control, which of the following is not a key requirement for the radionuclidic purity of the product? A. The radionuclide must be in the desired chemical form. B. The radionuclide must have a suitable half-life for imaging. C. The radionuclide must not decay into undesirable daughter isotopes. D. The radiopharmaceutical must be stable at room temperature. Answer. Correct answer. D. The radiopharmaceutical must be stable at room temperature. Explanation. While radiopharmaceutical stability is important, the requirement for radionuclidic purity specifically refers to ensuring that the correct isotope is present in the desired chemical form and that it does not decay into other isotopes that could interfere with imaging or therapeutic effectiveness. Stability at room temperature is a concern for storage, but directly related to radionuclidic purity. Question 4. When analyzing a radiopharmaceutical kit preparation, Mrs. Andrews notes that the radiolabeling process is highly dependent on the interaction between the radionuclide and the compound in the kit. What is the key principle behind most radiolabeling reactions in such kits? A. The reaction requires a solvent system that enhances the chemical reactivity of the radiolabel. B. The reaction must be carried out under an inert atmosphere to prevent oxidation. C. The radiolabel must chemically bond with the target molecule in a specific site. D. The radiolabel must be reduced to its elemental form before binding to the target molecule. Answer. Correct answer. C. The radiolabel must chemically bond with the target molecule in a specific site. Explanation. Radiolabeling typically requires that the radionuclide chemically binds to the target molecule in a stable and specific manner. This ensures that the radiopharmaceutical retains its intended biological activity and targeting properties. Solvent systems and reducing agents may be used to facilitate the labeling process, but the primary principle is the stable binding of the radiolabel to the compound in a predictable and effective way. Question 5. In light of recent developments in radiation safety, Dr. Thompson is overseeing a radiopharmaceutical preparation area. Which of the following practices is most essential to minimize radiation exposure to workers? A. Using lead shielding during the preparation of radiopharmaceuticals. B. Regularly rotating personnel in the radiopharmacy to limit exposure. C. Employing fume hoods to eliminate airborne radioactive particles. D. Ensuring all waste is disposed of in radiologically safe containers. Answer. Correct answer A. Using lead shielding during the preparation of radiopharmaceuticals. Explanation. Lead shielding is one of the most effective ways to prevent radiation exposure during the preparation of radiopharmaceuticals. The other practices mentioned are valuable, but lead shielding directly protects against gamma radiation and is a core element of radiation safety in radiopharmacy. Rotating personnel and managing waste are important, but shielding is the most direct method of limiting exposure. Question 6. Based on the information provided, which of the following is the most critical factor in determining the stability of a radiopharmaceutical after synthesis? A. The chemical integrity of the target molecule post-labeling. B. The storage conditions, including temperature and humidity. C. The particle size of the radiolabeled preparation. D. The presence of stabilizing agents in the preparation. Answer. Correct answer. B. The storage conditions, including temperature and humidity. Explanation. While the chemical integrity and stabilizing agents are important, the storage conditions play a critical role in maintaining the stability of the radiopharmaceutical. Improper temperature or humidity can accelerate degradation or unwanted reactions, leading to reduced efficacy or contamination. Temperature and humidity control are vital to ensure radiopharmaceutical remains effective until its use. Question 7. From the perspective of waste management in radiopharmacy, Mrs. Clark is tasked with ensuring compliance with regulations regarding radioactive waste disposal. Which of the following guidelines is essential for ensuring proper disposal? A. Radioactive waste should be stored in sealed containers until it decays to background levels. B. All radioactive waste must be stored in the radiopharmacy until it reaches a non-radioactive status. C. Radioactive waste must be disposed of through incineration, regardless of the type. D. Radioactive waste can be mixed with non-radioactive waste if it is fully contained. Answer. Correct answer. A. Radioactive waste should be stored in sealed containers until it decays to background levels. Explanation. Proper waste management requires that radioactive waste be securely stored and decayed to background levels before disposal. The decay process helps reduce the radioactive risk. Mixing radioactive waste with non-radioactive materials or incineration could violate safety and regulatory standards. Waste protocols must follow strict guidelines to ensure both safety and environmental compliance. Question 8. Considering the evidence in radiopharmacy regulations, Dr. Patel is assessing the suitability of a new radiopharmaceutical for clinical use. Which of the following quality control procedures should be prioritized to ensure the radiopharmaceutical meets safety and efficacy standards? A. Radiochemical purity testing using thin-layer chromatography. B. Analysis of particle size distribution to ensure optimal biological distribution. C. Assessment of sterility using culture media tests. D. Evaluation of radionuclidic purity via gamma spectrometry. Answer. Correct answer. B. Analysis of particle size distribution to ensure optimal biological distribution. Explanation. Particle size is crucial for the biological behavior of the radiopharmaceutical as it affects tissue uptake, imaging clarity, and elimination, while sterility and purity testing are vital, ensuring that the radiopharmaceutical has the right particle size for optimal biological distribution is essential for its reliable clinical results. Question 9. In an effort to improve the efficiency of radiopharmaceutical preparation, Mr. Martinez is considering automation for certain aspects of the process. What is the primary advantage of automating radiopharmaceutical production? A. Reducing the risk of contamination during the preparation process. B. Allowing for the use of more complex chemical labeling techniques. C. Ensuring more consistent product quality across batches. D. Enabling faster production of radiopharmaceuticals. Answer. Correct answer. C. Ensuring more consistent product quality across batches. Explanation. Automation in radiopharmaceutical preparation provides significant advantages in ensuring consistent quality by minimizing human error and variability, while contamination risk and speed can also be improved. The primary benefit is the ability to standardize processes, ensuring that every batch meets the required quality control standards. Question 10. The prevailing attitude toward radiation safety has evolved over time. Dr. Green is reviewing the ALARA principle in the radiopharmacy. Which of the following best represents the implementation of the ALARA principle in daily practice? A. Minimizing radiation exposure by using protective lead aprons and shielding during radiopharmaceutical preparation. B. Limiting the number of radiopharmaceuticals used in patient imaging to reduce overall exposure. C. Increasing radiation exposure for faster patient diagnosis with later adjustments in treatment. D. Keeping all doses of radiopharmaceuticals as low as possible, regardless of patient condition. Answer. Correct answer. A. Minimizing radiation exposure by using protective lead aprons and shielding during radiopharmaceutical preparation. Explanation. The ALARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure in all stages of radiopharmaceutical handling, particularly during preparation. Using shielding such as lead aprons ensures that workers are protected without compromising the quality. Radiopharmaceuticals. Other options either misinterpret the principle or focus on aspects not aligned with ALARA's core intent. Question 11. Based on the information, a patient named Isis Thompson is scheduled for a myocardial perfusion imaging study using a technetium-99 meters radiopharmaceutical. She has a known history of renal impairment. What should be considered when preparing the radiopharmaceutical for a procedure? A. The dose of technetium-99 meters should be reduced by 25% for all patients with renal impairment. B. The renal function of Isis Thompson must be evaluated to adjust the radiopharmaceutical dose and ensure adequate elimination. C. Renal impairment has no effect on the preparation of radiopharmaceuticals for myocardial perfusion imaging. D. A high dose of technetium-99 meters should be used in patients with renal impairment to compensate for delayed excretion. Answer. Correct answer. B. Explanation. Renal function significantly influences the pharmacokinetics of radiopharmaceuticals. In patients like Isis Thompson with renal impairment, dosing adjustments may be necessary, and renal clearance should be monitored to avoid unnecessary radiation exposure. A reduced dose may be needed to prevent excessive radiation accumulation in the kidneys. The guidelines emphasize patient-specific adjustment, radiopharmaceutical dosing to minimize risks. For myocardial perfusion imaging, it is important to assess the patient's renal status before proceeding. Question 12. In the context of good manufacturing practice (GMP) regulations in radiopharmacy, which of the following is a critical factor to ensure the production of high-quality radiopharmaceuticals? A. Maintaining the sterility and pyrogenicity of the radiopharmaceuticals during production and storage. B. Ensuring that radiopharmaceuticals are prepared with the highest possible activity regardless of patient-specific needs. C. The use of non-sterile components as long as the radiopharmaceuticals are administered immediately after preparation. D. Only the radiopharmacist must perform all GMP-related procedures not involving staff members. Answer. Correct answer. A. Explanation. GMP in radiopharmacy emphasizes strict adherence to sterility and pyrogenicity standards to ensure the safety and efficacy of radiopharmaceuticals. Sterility prevents microbial contamination, while pyrogenicity testing ensures that no harmful substances are present. These measures are critical for patient safety. According to GMP guidelines, non-sterile components should never be used. The manufacturing environment must be controlled to meet rigorous quality standards. Question 13. A radiopharmacist is preparing a PET radiopharmaceutical that requires a synthesis reaction involving fluorine 18. What is the most important consideration in the synthesis of this radiopharmaceutical? A. Fluorine 18 should be used in excess to ensure complete reaction and maximal radiolabeling efficiency. B. The target molecule must be stable under the reaction conditions to prevent decomposition. C. The radiopharmaceutical preparation can be performed in any laboratory without specific equipment or facilities. D. Fluorine 18 can be used for synthesis without any purification process as it is inherently pure. Answer. Correct answer B. Explanation. Stability of the target molecule is a critical factor in the synthesis of PET radiopharmaceuticals. The fluorine-18 radionuclide needs to be incorporated into a stable precursor molecule under controlled conditions. Decomposition of the target molecule during synthesis can lead to impurities, affecting both the quality and safety of the radiopharmaceutical. Purification processes are often necessary. Ensure the final product meets required radiochemical purity levels. Question 14. Considering the evolving regulations in nuclear medicine, what is the primary responsibility of the radiopharmacist with respect to radiation safety? A. Ensure that only medical staff are exposed to radiation, avoiding patient exposure. B. Adhere to the ALARA principle to minimize radiation exposure to both patients and staff while maintaining diagnostic efficacy. C. Only ensure radiation safety when handling high-activity radiopharmaceuticals, as low-activity drugs do not require precautions. D. Radiation safety regulations are not necessary during the preparation of radiopharmaceuticals, as these substances are not radioactive until administered. Answer. Correct answer B. Explanation. The radiopharmacist is responsible for ensuring that radiation exposure is kept as low as reasonably achievable (ALARA) for both patients and staff. The ALARA principle involves optimizing the radiopharmaceutical preparation and administration processes to minimize exposure while ensuring effective imaging or treatment. It is applicable to all radiopharmaceuticals, regardless of activity level, to patient and staff safety. Strict adherence to radiation safety guidelines is required by regulatory agencies worldwide. Question 15. What would happen if the calibration of a dose calibrator used for radiopharmaceutical preparation is found to be inaccurate during an inspection? A. The dose calibrator should be recalibrated immediately and all affected radiopharmaceuticals must be recalled. B. The radiopharmaceuticals can be used without recalibration if the discrepancy is within 5%. C. Only the radiopharmacist's measurement should be checked, as the technician's calibration does not affect the process. D. If the discrepancy is discovered after the preparation, it is acceptable to proceed with patient administration, as long as the dose is verified post-preparation. Answer. Correct answer A. Explanation. Inaccurate calibration of a dose calibrator can lead to incorrect dosing of radiopharmaceuticals, potentially resulting in underdosing or overdosing. The discrepancy must be immediately addressed and recalibration should be performed. Affected radiopharmaceuticals must be recalled to ensure patient safety. Regulations from various health authorities require that all equipment used in the preparation of radiopharmaceuticals, including dose calibrators, be calibrated regularly and accurately. Question 16. Under the assumption that a radiopharmaceutical for bone scintigraphy is being prepared, which of the following factors would most likely affect the radiochemical purity of the final product? A. The ambient temperature during the preparation process. B. The physical appearance of the radiopharmaceutical. C. The time elapsed between radiopharmaceutical preparation and administration to the patient. D. The type of syringe used to administer the radiopharmaceutical. Answer. Correct answer C. Explanation. Radiochemical purity refers to the proportion of the radiopharmaceutical that is in the desired form, free from impurities or degradation products. The time elapsed between preparation and administration plays a critical role in maintaining radiochemical purity. If the product is not used within an appropriate time window, degradation can occur, reducing efficacy and safety. Other factors like temperature and equipment may also play a role, but time is a primary factor in maintaining quality. Question 17. Given the circumstances, which of the following best describes the process of direct radiolabeling of a biomolecule for diagnostic purposes in radiopharmacy? A radioactive isotope is directly attached to a target biomolecule, typically involving a simple chemical reaction. B. A carrier molecule is used to encapsulate the radioisotope, which then binds to the biomolecule after administration. C. A biologically inert substance is attached to the radioisotope to prevent interaction with the biomolecule. D. Direct radiolabeling is not commonly used in radiopharmacy due to its high failure rate. Answer. Correct answer, A. Explanation. Direct radiolabeling involves the chemical attachment of a radioactive isotope to a biomolecule, often through a covalent bond. This is a common method used in radiopharmacy for diagnostic imaging, particularly in SPECT and PET. The process ensures that the radiopharmaceutical retains the biological activity of the biomolecule while enabling detection through imaging. Successful direct labeling is on optimizing reaction conditions to maintain the stability and activity of the biomolecule. Question 18. The conventional wisdom about radiopharmaceutical waste management states that which of the following is true? A. Radiopharmaceutical waste can be discarded into regular trash after the radioactivity has decayed to a safe level. B. Radiopharmaceutical waste must always be stored until the radioactivity has completely decayed, regardless of the activity level. C. Waste containing radiopharmaceuticals must be segregated, stored, and disposed of according to national regulations and institutional guidelines. D. Radiopharmaceutical waste can be done by incineration without restrictions if the waste is in solid form. Answer. Correct answer. C. Explanation. Radiopharmaceutical waste must be managed following strict regulations to prevent environmental contamination and protect public health. The waste must be segregated, stored in designated containers, and disposed of in compliance with national and institutional regulations. Some forms of waste may require storage until radioactivity decays to safe levels, but all disposal processes must follow established protocols. Incineration is generally not permitted for radioactive waste without specific safety measures and permits. Question 19. A patient, Mr. Smith, is receiving a SPECT scan for thyroid imaging. If the radiopharmaceutical used is iodine 123, which of the following is a key consideration during the preparation and administration of this radiopharmaceutical? A. The radiopharmaceutical must be prepared under sterile conditions but does not require pyrogenicity testing. B. Iodine 123 should be administered with an oral dose of iodine to enhance uptake by the thyroid gland. C. The preparation of iodine 123 radiopharmaceuticals requires handling in a specialized radioactive facility due to the high dose of radiation. D. Careful patient monitoring required to ensure proper thyroid uptake, and the dosage should be adjusted based on the patient's age. Answer. Correct answer. D. Explanation. When preparing and administering iodine 123 for thyroid imaging, patient-specific factors such as age and thyroid function must be considered to ensure optimal uptake. The radiopharmaceutical should be prepared under sterile conditions, and pyrogenicity testing is essential. The dosage may need adjustment based on the patient's condition, as thyroid uptake varies with age and metabolism. Monitoring patient during administration is also critical for optimal imaging results. Question 20. In the context of the mechanism of action of commonly used SPECT radiopharmaceuticals, which of the following best describes how technetium-99 meters labeled compounds function in myocardial perfusion imaging? A. Technetium-99 meters binds to myocardial tissue, reflecting areas of decreased perfusion during ischemic events. B. Technetium-99 meters is absorbed by healthy myocardial cells and retained for several days to detect late-stage myocardial injury. C. Technetium-99 meters labeled compounds are primarily used for detection of myocardial infarction after tissue necrosis occurs. D. Technetium-90 meters labeled compounds inhibit blood flow to the myocardium to highlight ischemic areas. Answer. Correct answer. A. Explanation. Technetium-99 meters labeled compounds are used in myocardial perfusion imaging to assess blood flow to the heart. These radiopharmaceuticals bind to myocardial tissue with areas of decreased perfusion, such as during ischemic events showing reduced uptake. This allows the identification of areas of the heart that are not receiving adequate blood supply, providing valuable diagnostic information. EANM is typically done shortly after administration to capture real-time perfusion data. Question 21. When preparing a radiopharmaceutical for a SPECT study involving technetium-99 meters, which of the following best describes the radiopharmacist's primary responsibility during the preparation process? A. Ensuring that all radiopharmaceuticals are administered without considering patient-specific factors. B. Ensuring the radiopharmaceutical is properly labeled and has sufficient radiochemical purity for accurate imaging results. C. Ensuring that only senior radiopharmacists are allowed to handle high-activity doses of technetium-99 meters. D. Ensuring that all technetium-99 meters doses are standardized across all without adjustments. Answer. Correct answer. B. Explanation. The primary responsibility of the radiopharmacist is to ensure that the radiopharmaceutical has proper radiochemical purity, which is essential for accurate diagnostic imaging. This includes confirming the correct labeling, purity, and proper administration of the radiopharmaceutical based on patient-specific needs. This ensures the quality of the imaging results and minimizes any potential risks. Question 22. A patient is undergoing a PET scan using a fluorine-18 labeled radiopharmaceutical. Which of the following is the most critical consideration when preparing and administering fluorine-18? A. Fluorine-18 should be handled using lead shielding to reduce radiation exposure during preparation and administration. B. The fluorine-18 labeled compound should be used only within a strict time window after its synthesis to ensure its efficacy. C. Fluorine-18 needs to be administered in doses larger than those for other radiopharmaceuticals to ensure sufficient imaging quality. D. Fluorine-18 requires a cooling process for administration to maintain its integrity. Answer. Correct answer. B. Explanation. Fluorine-18 has a half-life of approximately 110 minutes, which means that it should be used shortly after synthesis to maintain its radiochemical purity and ensure optimal imaging quality. Delays can result in reduced effectiveness and could compromise the diagnostic value of the scan. Fluorine-18 also requires proper handling and shielding due to its radioactive nature. Question 23. During a radiopharmaceutical synthesis involving carbon-11, which of the following processes must be carefully controlled to ensure the success of the radiolabeling? A. Temperature and pH must be strictly monitored to ensure that the carbon-11 binds efficiently to the target molecule. B. The carbon-11 isotope does not require any special handling as it is chemically stable in any environment. C. Only experienced radiopharmacists should handle the carbon-11 to avoid potential radioactive contamination. D. The reaction mixture must be cooled immediately after carbon-11 incorporation to prevent instability in the labeled compound. Answer. Correct answer. A. Explanation. Carbon-11 is a short-lived isotope with a half-life of 20 minutes, and the conditions under which it binds to the target molecule must be carefully controlled. This includes precise control over temperature and pH during the radiolabeling process to ensure efficient incorporation into the molecule. Inadequate conditions could result in poor labeling efficiency, leading to suboptimal radiopharmaceuticals imaging. Question 24. A hospital is using iodine-131 for a therapeutic application in a patient with hypothyroidism. What is a key safety measure for the radiopharmacist to consider during the administration of iodine-131? A. The patient should be isolated in a specific treatment room to limit exposure to others during the period of radioactivity. B. The iodine-131 should be administered in a lower dose than usual to avoid any risks of radiation exposure. C. The radiopharmacist should wear lead gloves to prevent exposure to iodine-131 during preparation. D. No additional safety precautions are needed since iodine-131 is only mildly radioactive. Answer. Correct answer. A. Explanation. Iodine-131 emits beta radiation and gamma rays, making it necessary to isolate the patient to minimize radiation exposure to others, especially during the period of high radioactivity. Proper isolation protocols must be followed, including limiting contact with family members and staff. These measures ensure safety while the patient undergoes the therapeutic procedure. Question 25. Which of the following describes the most significant risk of using radiopharmaceuticals with a high radiation dose for diagnostic imaging? A. The risk of radiation-induced tissue damage is typically negligible due to the brief exposure times in diagnostic imaging. B. High radiation doses do not affect diagnostic accuracy, as the imaging is not influenced by radiation levels. C. High radiation doses may increase the long-term risk of cancer, particularly if administered over multiple imaging sessions. D. High radiation doses are primarily a concern for the radiologist and not for the patient. Answer. Correct answer. C. Explanation. Although diagnostic imaging typically uses low doses of radiation, repeated exposure to high radiation doses can accumulate over time, increasing the risk of radiation-induced cancer. This is a key concern in nuclear medicine, especially for patients undergoing multiple imaging sessions. Ensuring that radiation exposure is kept to the minimum necessary for accurate diagnosis is a fundamental principle of radiology and nuclear medicine. Question 26. A radiopharmaceutical involving gallium-67 is used to assess the presence of infection or inflammation. What is the critical factor to consider before administering the gallium-67? A. The patient should have an empty stomach prior to the administration to avoid any gastrointestinal interference with the imaging. B. Gallium-67 should be injected only when the patient is in a stable condition without any significant fever. C. Gallium-67 must be prepared and administered in the presence of a medical physicist due to the complexity of its use. D. The timing of the imaging is important. The scan should typically occur for 72 hours after gallium-67 administration. Answer. Correct answer. D. Explanation. Gallium-67 is commonly used to identify infection and inflammation, and the imaging typically occurs for 72 hours after administration to allow sufficient uptake by the tissues of interest. Early imaging may not provide sufficient diagnostic information. Proper timing ensures optimal imaging results for infection or inflammation detection. Question 27. What is the most important aspect of using a dose calibrator for measuring the activity of radiopharmaceuticals before administration? A. The dose calibrator should be recalibrated only once every year, as this is sufficient for routine use. B. The activity of the radiopharmaceutical must be measured in the same vial as it will be administered to ensure accuracy. C. The dose calibrator should be able to detect a range of isotopes, and calibration should be specific for each isotope used. D. Activity measurements are not needed as long as the radiopharmaceutical is within the established guidelines. Answer. Correct answer. C. Explanation. The dose calibrator must be calibrated specifically for each isotope used in radiopharmaceutical preparation, as each isotope may have different radiation characteristics. Accurate measurements of activity are crucial to ensure that the correct dose is administered to the patient, and recalibration should occur regularly to maintain accuracy. Question 28. In radiopharmacy, which of the following statements is true regarding the concept of radiochemical purity? A. Radiochemical purity refers to the total radioactive content of the radiopharmaceutical. B. Radiochemical purity is essential only for therapeutic radiopharmaceuticals, not diagnostic agents. C. Radiochemical purity is the proportion of the radiopharmaceutical that is in the desired chemical form and free from radiochemical impurities. D. Radiochemical purity is not necessary for imaging procedures as long as within safe limits. Answer. Correct answer. C. Explanation. Radiochemical purity is critical for ensuring that the radiopharmaceutical is in the correct chemical form to perform its intended function. The radiopharmaceutical should not contain significant amounts of radiochemical impurities, as these can interfere with imaging and therapeutic efficacy. High radiochemical purity is essential for accurate diagnostic results. Question 29. A patient undergoing a nuclear medicine procedure is allergic to iodine. What should be the radiopharmacist's approach in preparing the radiopharmaceutical for this patient? A. The radiopharmacist can prepare the radiopharmaceutical as usual, since iodine allergy does not affect radiopharmaceuticals. B. The radiopharmacist should choose an alternative radiopharmaceutical that does not contain iodine to avoid allergic reactions. C. The radiopharmacist should administer the iodine-based radiopharmaceutical with an antihistamine to counteract the allergy. D. The radiopharmacist should proceed with iodine-based radiopharmaceutical as the dose is too small to cause an allergic reaction. Answer. Correct answer. B. Explanation. If a patient is allergic to iodine, the radiopharmacist should avoid using iodine-based radiopharmaceuticals. There are alternative radiopharmaceuticals that do not contain iodine, and these should be used to prevent any potential allergic reactions. Patient safety should always be the top priority when selecting a radiopharmaceutical for diagnostic or therapeutic use. Question 30. A radiopharmacist is preparing a radiopharmaceutical for an imaging study of a tumor using a technetium-99 meters compound. Which of the following is the best practice for ensuring proper storage of the radiopharmaceutical before patient administration? A. The radiopharmaceutical should be stored in a cool, dry place to prevent any chemical degradation. B. The radiopharmaceutical should be stored in a sealed container at room temperature away from light and humidity. C. The radiopharmaceutical should be stored in the freezer to preserve its radioactivity. D. The radiopharmaceutical should be stored in a well-ventilated area with no restrictions on temperature. Answer. Correct answer, B. Explanation. The radiopharmaceutical should be stored in a controlled environment, ideally at room temperature and protected from light and humidity to maintain stability. Storing the radiopharmaceutical under proper conditions helps ensure that it remains effective and retains its radiochemical purity until administration. The freezer is generally not appropriate for storing radiopharmaceuticals unless specified by the manufacturer.